Hi everyone, you're welcome to the Coming Mom. If you're new here, you're amazingly welcome to our community. To my returning viewers, welcome back. Kindly subscribe, like, share, and click on the notification bell and keep the comment section engaging. Today's video will illuminate on guide to first trimester. Guide to first trimester. How you can go about your first trimester. How you can have an amazing first trimester. Most moms do not know the path to go rightly. Each pregnancy you have a new experience. So as mothers, our minds are clouded with various questions, various whys, but we struggle to give ourselves a valid answer. That's why we are here to answer all of your unanswered questions correctly. The first trimester is the beginning of pregnancy. It is the earliest phase of pregnancy. It is the first 3 months of your pregnancy. It starts on the first day of your period. For instance, you had your last period on the 8th of July to 12th of July. Then in August, you missed your period. To calculate the beginning of your pregnancy, you will start from the 8th of July. You're pregnant. Yes, you're already pregnant before you actually discovered you missed your period. The first trimester lasts 13 weeks. There is this arbitrary norm of 1 week added to 8 instead of 12 weeks, which makes it a full calculation. The normal myth, we say you calculate the full moon with it. So that's why it's always 13 weeks. 13 weeks to make it full. There are some months that are not really 5 weeks. Some are 4 weeks. So it is better in the standard way to calculate with 13 weeks. And to get started, most moms are always anxious at this time because it's a phase of rapid changes for both you and your unborn baby. Knowing what to expect will help you get ready for the months ahead. When you know what to do, you get prepared ahead. When you lay your bed ready, then trust me, you're going to have an amazing and a great journey ahead. Pregnancy is different from every woman. Some women glow with good health during those first 3 months. Others feel sick and beautiful, while some feel miserable. During my first trimester, I was glowing but miserable. Like I was weak. So many things happen in your body during the first 3 months. According to medical experts, during the first trimester, your baby changes from a fertilized egg to a fully formed fetus. So at this stage, I would advise you to don't use random drugs because your baby is still fragile. Your baby is still very fragile. So be careful of the drugs you use. Today, I will be telling us 10 guides to first trimester. The report of my last scan from the doctor in charge was that for the latest years of his experience in the field, mine was the best scan ever. Why? Because my baby was in great condition because I took all these 10 guides, which I'll be sharing with you firmly. Guide 1: choose a doctor or a preferred hospital. This is a delicate decision. You need to check the responsiveness of the hospital to its users' expectations. When I say responsiveness, how do they respond to you? How do they take care of their patients? This is a delicate decision. So you need to check the responsiveness of the hospital to its users' expectations of the non-health enhancing aspect of their care. So are they loving? Are they accommodating? Do they have the quality of basic amenities? Or how is their clarity of communication? Do they communicate well with their patients? You know, communication is very effective. It is effective when there is when there is feedback. So some doctors will tell you to go for a scan and won't tell you the scan's interpretation. So all this must be considered. Ask people around you which is the best. We pray that we will not fall prey of nonchalant healthcare workers. And guide 2: schedule a prenatal visit as soon as you know you're pregnant. Schedule a prenatal visit as soon as you're pregnant. Call your provider to schedule your first prenatal checkup as soon as you know you're pregnant. Prenatal care is medical attention provided to you while you're pregnant. So you need that medical attention. They need to check you. Your healthcare physician will examine you and your developing baby at each visit. Please schedule a prenatal basis. It's very, very important, because as soon as you find out you're pregnant, just contact them, schedule your own appointment. If you're feeling fine, go to all of your prenatal care appointments. It does not matter, even if you're feeling fine. Getting prenatal care early and regularly can help you have a healthy pregnancy and a healthy baby. If your baby is born between 39 weeks, that is 1 week before your due date, and 40 weeks, 6 days, it is considered what? Full term. So when you go for your checkup, they would always take care of you and your baby. So if he is born full term, the doctor will check your weight, blood pressure, test your urine, and listen to your baby's heartbeats. Guide 3. Start taking your pregnancy vitamins. During the first trimester, I was taking folic acid, vitamin B12, and calcium, but I needed to take over 10 vitamins. So I bought a product that had all in one, because I was used to take all at a time. So this drug took away my morning sickness and I became very strong. So it depends. You ask your doctor if you could actually take some vitamins. Guide 3, take your vitamins. They are very, very important, especially B12. It helps you and take nausea away. Guide 4, take enough water. Can I scream it loud again? Take enough water. Take water always. But if water makes you vomit, just do it gradually by sipping it. You need to stay hydrated to make it easier for your body to transfer nutrients to your baby. Water helps in transferring nutrients to your baby. So guide 5, sleep. The first trimester of your pregnancy can be challenging. You need to sleep well, but proper sleep practices can help you sleep better and get more sleep in total. So you can sleep in any position throughout the first trimester, but it's a good idea to start practicing side. You sleep on your left side. It's very important, because when you get to your later pregnancy, you would be comfortable doing that. So a large body of evidence suggests that resting on your left side is the healthiest sleep, because for you and your fetus, so this increases circulation as the baby grows by reducing the uterus pressure from resting on the veins, on the back veins and the internal organs. So on the other hand, sleeping on your back puts pressure on your internal organs and veins during the next 2 trimesters. So this can pose severe health challenges. So for people who prefer to sleep on their stomach or back, switching to this position early on may make the change simpler. So try and sleep on your left side. But I've heard a couple of mothers saying that they sleep on their backs throughout their pregnancy and their baby never had any issue. One of the myths is that when you sleep on your back, your baby's eyes will not be in the right direction. So medically, it's good to sleep on your left side, though not easy, but you can do it. So the first trimester of pregnancy is a sensitive stage, and any medication, especially sleeping drugs, should be avoided. So practice sleep hygiene. You can also adopt diet adjustment and avoid eating soon before bed to alleviate nighttime discomfort. So pregnant women who experience nausea in the first trimester should aim to eat smaller, more nutritious meals more frequently rather than bigger meals, not heap of food. So avoid hot and fatty food to avoid heartburn. All this will help you during your pregnancy journey. These guides really helped me. That's why I'm sharing them with you today. So I hope you follow these guides and you have an amazing first trimester. So guide 6, ask for help. Please ask your partner for a helping hand, or you hire some temporary help. You can hire a professional cleaning service for your home. You can't do it all alone. Outside Nigeria, there are some professional services, cleaning services that could come to your house. Even some still do it in Nigeria, who could come to your house to clean everything up. So just hire a professional service that could help if your partner is not around. So you can't do it all alone, but don't be lazy. Don't do all the chores at this delicate time to avoid miscarriage. So take care of yourself and your baby. Don't go for hours of doing chores without a break. Just take it one step at a time. There is no need to rush. So just one step at a time. Take one step at a time. There's no need to rush. So if you choose to tidy the rooms yourself, sweep a day. I'm giving us tips. So maybe tonight you sweep. The next day, what will you do? you can mop your room. So all these things, you take everything little by little. Guide 7, get a calendar or a diary to mark your baby week by week. Trust me, during your pregnancy you could be clumsy, so get a diary would remind you of the week you just left without scratching your brain. So with your diary, you can write all your pregnancy symptoms and explain them to your doctor in your next visit. Let me show you my diary. This is my diary when I had my son. It's a very good diary, very good one. It will tell you tips. It had some tips here, and it will tell you the blood test you're to run, your blood pressure, your urine test, and it will start from week 3 to 10. So I was ticking it. I started from week 6 because I discovered from week 6 of my pregnancy, and I was writing everything that happened: vomiting, morning sickness, tiredness, and loss of appetite. I wrote it there. And week 7 I ticked it. Week 8 I did. Week 9, week 10 I did all of that, all through. So I did week 11, 12, I did all this. So week 15 to 18 I had abdominal pains, I have back aches, I had headaches. I even dated it down 19/4/2020. So all these things will help you. So documenting this time will not only allow you to preserve fleeting experiences, but it will also make for a better, healthier trip. Preparing for motherhood can be an emotional roller coaster. Experiencing it and documenting it down can help you cope with stress and improve your physical strength and immunity. Guide 8. Stay away from alcohol and smoking. During pregnancy, there is no safe time to consume alcohol. During pregnancy, particularly before a woman realizes she's pregnant, alcohol can cause complications for the growing fetus. So drinking alcohol during the first 3 months of pregnancy can result in an abnormal facial appearance in the infant. Small head size, shorter than average height, low body weight, poor coordination, hyperactive behavior, difficulty with attention, poor memory, difficulty in school, especially with math, learning disabilities, speech and language delays, intellectual or disability or low IQ, reasoning and judgment skills, sleeping and sucking problems as a baby, vision or hearing problems, problems with the heart, kidney. So you need to look at all these things it could cause to your baby. So why should you venture into drinking alcohol during pregnancy? Just abstain, just for 9 months, to have an amazing child. Guide number 9. Cook your meat for at least 30 to 40 minutes. Raw or undercooked meat should be avoided during pregnancy because of the risk of contracting toxoplasmosis, a bacterial infection commonly found in raw meat. Avoid suya too. Yes, avoid suya. It's not always cooked to up to 30 minutes, but ensure to wash and cook your meat thoroughly. Guide 10. Avoid x-rays during your first trimester. X-rays should be avoided during pregnancy if possible, but you could talk to your medical practitioner. Yes, they say it's final, but if your medical practitioner proposes an x-ray, you should alert them to the pregnancy and the medical decision as to whether it is appropriate if it is taken in light of this knowledge. So you need to let your practitioner know that you are pregnant. Let them know you're pregnant before they suggest, if you have any side sickness. So let them know that you are pregnant, that this is the reason why you can't take the x-ray. I'm sure they won't force you to undergo an x-ray during pregnancy. I hope all these guys really helped. Many thanks for sticking around. Do not forget to like, share, subscribe and click on the notification bell to get notified when we drop new videos. This community cares about you. Thank you.